Every time you use the bathroom, you leave behind a small piece of information about what is happening inside your body. Most people never look twice. They flush, wash their hands, and move on. But sometimes the toilet can reveal a change before you notice anything else. A sudden change in color, an unusual texture, persistent mucus, blood, greasy stool, or a major shift in how often you go can all be clues worth paying attention to. None of these signs automatically mean something serious is wrong. Many have harmless explanations. But the important question is not whether your stool looks different once. The important question is whether the change is persistent, unexplained, repeatedly returning, or happening alongside symptoms such as pain, weakness, fatigue, weight loss, fever, or shortness of breath. Your digestive system is constantly processing food, absorbing nutrients, moving waste, and interacting with trillions of microorganisms. When that process changes, the final product can sometimes change with it. So before you flush away the evidence, there are 10 things you should know about what your stool may be telling you. Start with color, because it is one of the easiest changes to notice. Normal stool is usually brown, largely because of pigments produced during the normal breakdown of red blood cells and their processing through the liver and bile system. That means a significant change toward a pale, gray, or clay-like appearance can sometimes point toward reduced bile reaching the intestine. Bile plays an important role in digestion, particularly in the digestion and absorption of fats, and it normally contributes to the color of stool. If bile flow becomes reduced or blocked, stool can become noticeably lighter. Gallstones, problems affecting the bile ducts, and certain liver or biliary conditions can be among the possible causes. Some medications can also influence stool color. The important distinction is between an isolated, unusual bowel movement and a change that keeps happening. If your stool remains unusually pale for several days, repeatedly returns to that appearance, or appears along with abdominal pain, jaundice, dark urine, unexplained weight loss, or significant fatigue, it is not something to simply dismiss because you had an unusual meal. It deserves medical evaluation. Now consider a completely different color, black. Seeing dark stool does not automatically mean internal bleeding, because several harmless things can make stool appear very dark. Iron supplements are one example. Bismuth-containing medicines can do it as well, and certain foods or substances may change the color. But there is a particular type of black stool that deserves much more attention. Stool that is genuinely black, tar-like, sticky, and unusually foul-smelling. That appearance can be associated with digested blood, a condition known medically as melena. Blood that enters the digestive tract higher up, such as from the esophagus, stomach, or upper small intestine, can be altered as it travels through the digestive system. By the time it reaches the toilet, it may no longer look bright red. Instead, it can become dark and tarry. That is why color alone is not enough. You have to consider texture and smell, as well as the circumstances surrounding the change. If you believe you may be passing black tarry stool because of bleeding, especially if you also feel dizzy, weak, faint, unusually tired, or short of breath, seek prompt medical attention rather than assuming it is something you ate. There is another kind of bleeding that can look completely different. Fresh blood is often bright red because it has had less time to be broken down by the digestive tract. Bright red blood may come from an area closer to the rectum or anus, and common causes can include hemorrhoids or an anal fissure. But those are not the only possibilities. Bleeding can also originate farther inside the lower digestive tract, including the colon. This is why you should never assume that every episode of rectal bleeding is simply hemorrhoids, especially if it is new, recurrent, substantial, or accompanied by other changes in bowel habits. Where you see the blood can provide a clue, but it cannot provide a diagnosis by itself. Blood only on the toilet paper after wiping may have a different explanation from blood visibly mixed into the stool. Yet both deserve attention when they are persistent or unexplained. And there is one harmless source of apparent red stool worth remembering: food. Large amounts of beets or strongly colored foods can sometimes make stool look reddish. Tomato-heavy foods and artificial food coloring can also contribute. So the timing matters. If the red color disappears after the food is out of your system, that is very different from recurring blood without an obvious dietary explanation. There is another color and texture combination that deserves attention because it can tell you something about how your body is handling fat. Imagine stool that looks unusually yellow, greasy, oily, bulky, or difficult to flush, particularly when it also has a strong, unpleasant odor. One possible explanation is that more fat than usual is remaining in the stool because it was not properly digested or absorbed. The medical term often used for excess fat in stool is steatorrhea. Fat digestion depends on several parts of the digestive system working together. Bile helps emulsify fats, while enzymes produced by the pancreas, especially lipase, help break them down. The small intestine then absorbs the resulting nutrients. If bile flow is impaired, pancreatic enzyme production is insufficient, or the intestinal lining is unable to absorb nutrients properly, fatty stool can result. Conditions affecting the small intestine, including celiac disease, are among the possible causes. This is why persistent greasy stool should not simply be blamed on eating a fatty meal. A single unusual bowel movement after a rich dinner is one thing. Repeated oily or greasy stool is another. Now look at something many people notice but rarely understand: stool that floats. Floating by itself is not necessarily a warning sign. Stool can float because of trapped gas, particularly after changes in diet. If you suddenly increase your intake of fiber-rich foods or carbohydrates that are fermented by gut bacteria, the bacteria in your digestive tract can produce more gas. That gas can make stool less dense, allowing it to float. In that situation, you might notice the change after changing what you eat, and it may settle as your digestive system adapts. But floating stool can also occur when excess fat is present, particularly if the stool is greasy, difficult to flush, unusually foul-smelling, or repeatedly floating. The combination is more informative than the floating itself. Your gut microbiome also matters here. The microorganisms living throughout your digestive tract help process certain fibers and other compounds that your own digestive enzymes cannot fully break down. Changes in the composition or location of these microorganisms can influence gas, bloating, stool consistency, and digestion. Small intestinal bacterial overgrowth, often abbreviated SIBO, is one condition in which excessive bacterial activity occurs in the small intestine and can contribute to bloating and digestive symptoms. Again, floating stool alone cannot diagnose it. The next clue is not about color at all. It is about shape and consistency. Your stool can be surprisingly hard, extremely loose, or somewhere in between. And there is a useful medical tool designed to describe these differences: the Bristol Stool Form Scale. It divides stool into 7 basic types. At one end are separate, hard lumps that can be difficult to pass. The next type is a sausage-shaped stool with a lumpy surface. Then comes a sausage-shaped form with cracks on the surface. Type 4 is generally smooth, soft, and well-formed. Type 5 consists of softer pieces with relatively clear edges. Type 6 is loose, mushy stool with ragged edges. Type 7 is watery stool without solid pieces. You do not need to memorize every number to understand the main idea. The middle forms generally represent the consistency most people consider easier and more typical, while the two extremes can provide clues when they occur frequently. Hard stool often means that material is moving too slowly through the colon. As stool remains in the colon, more water can be absorbed from it, making it progressively harder and more difficult to pass. Constipation can have many causes. A diet low in fiber can contribute. Inadequate fluid intake can matter. Physical inactivity can slow bowel function in some people. Changes in the gut microbiome may play a role. Certain medications are notorious for causing constipation, and medical conditions, including an underactive thyroid, can affect bowel motility. The problem is not merely inconvenience. If you repeatedly have to strain, spend a long time on the toilet, or pass very hard stool, you can develop discomfort and hemorrhoids. And repeated straining may contribute to anal fissures or bleeding. That is why chronic constipation deserves more attention than simply accepting it as an unavoidable part of getting older. The opposite problem is stool that moves too quickly. When transit through the digestive tract accelerates, the colon has less opportunity to reabsorb water, which can result in loose or watery stool. An occasional episode is extremely common. A meal that did not agree with you, a temporary infection, certain medications, or a sudden dietary change can all produce short-term diarrhea. Stress can also influence bowel function because the digestive system is closely connected with the nervous system. But persistent diarrhea is a different story. Recurrent or chronic loose stools may occur with conditions such as irritable bowel syndrome, inflammatory bowel disease, certain food intolerances, infections, or other digestive disorders. The key is not to panic over one bad day. The body occasionally reacts to something it encounters. The concern rises when the pattern continues, keeps returning, or comes with symptoms such as dehydration, fever, blood in the stool, severe abdominal pain, unexplained weight loss, or significant weakness. There is an important difference between occasional digestive disruption and a pattern your body cannot seem to correct. Imagine eating a food you rarely consume, developing loose stool that evening, and feeling normal again the next day. That is very different from having diarrhea several times a week for months. The first may be temporary. The second deserves investigation. The same principle applies to constipation. Being unable to go for a day after a change in routine does not automatically mean disease. But if bowel movements become consistently difficult, painful, unusually infrequent, or significantly different from your normal pattern, it is worth discussing with a healthcare professional. Your personal baseline matters. There is no single bowel schedule that applies perfectly to every human being. That brings us to something else you may see in the toilet: mucus. A small amount of mucus in the digestive tract is normal. Your large intestine naturally produces mucus, which helps protect the intestinal lining and allows stool to pass more smoothly. You may never notice it, and that is completely normal. The concern is when mucus becomes obvious, abundant, recurrent, or accompanied by other changes. Visible mucus mixed with blood, persistent diarrhea, abdominal pain, fever, or a major change in bowel habits deserves attention. Mucus can appear with temporary intestinal irritation or infection, but it may also occur in conditions such as irritable bowel syndrome or inflammatory bowel disease. It is not possible to identify the cause simply by looking at the mucus. The appearance is a clue, not a diagnosis. If it appears once and disappears, there may be little reason for alarm. If you repeatedly see a significant amount, particularly alongside other symptoms, that is when you should stop ignoring it. Then there are undigested pieces of food. You may notice a fragment of corn, a seed, a vegetable skin, or another recognizable piece, and immediately wonder whether your body failed to digest the meal. Usually, a small amount of recognizable plant material is not a problem. Certain plant cell structures and fibers are resistant to complete digestion, and some foods can pass through the digestive tract with portions still recognizable. Chewing thoroughly can help break food into smaller pieces, but it does not make every component completely digestible. The concern is when you consistently see large amounts of undigested food, especially when the change is accompanied by diarrhea, greasy stool, bloating, fatigue, or unexplained weight loss. At that point, the question becomes whether digestion or absorption is functioning properly. Several parts of the digestive system are involved in breaking food down. The stomach contributes acid in digestive processes that help prepare food for further digestion. The pancreas produces enzymes involved in breaking down carbohydrates, proteins, and fats. Bile supports fat digestion. The small intestine absorbs nutrients, and the microbiome helps process certain components that human digestive enzymes cannot handle efficiently, especially various forms of fiber and plant compounds. If one of these systems is impaired, digestion can change. For example, problems involving pancreatic enzymes can interfere with the breakdown of nutrients. Disorders affecting the small intestine can interfere with absorption. But again, seeing a few pieces of food in the toilet is not enough to identify any of these conditions. The pattern and the accompanying symptoms matter much more than one isolated observation. Now we reach the 10th signal. And in some ways, it is one of the most useful because it requires you to know your own normal. How often are you actually going? People sometimes say they are regular because they have a bowel movement on a predictable schedule, even if that schedule is only every few days. But regularity is not just about whether the timing is consistent. Frequency, stool form, ease of passage, and whether there has been a sudden change all matter. Bowel habits can naturally vary between individuals. Some people go multiple times a day. Others go less frequently. A commonly used broad reference range for bowel movement frequency is roughly 3 times per day to 3 times per week. But that range does not mean everyone within it is automatically healthy or everyone outside it is automatically sick. Your usual pattern is extremely important. Suppose you normally have a comfortable bowel movement every morning and suddenly begin going 4 or 5 times a day. That is a meaningful change, even if each individual episode looks normal. An increase in frequency can happen with an infection, dietary reaction, certain medications, stress, or conditions affecting the thyroid or intestines. On the other hand, if you normally go once a day and suddenly start going only once every 3 or 4 days, that is also a meaningful change. Constipation can be related to low fiber intake, inadequate fluids, reduced activity, medications, thyroid problems, or other medical conditions. The point is not to obsess over a particular number. The point is to notice when your digestive pattern changes and stays changed. Medications deserve special attention because they are an often overlooked cause of bowel changes. Some pain medications, particularly opioid medications, commonly cause constipation by slowing gastrointestinal movement. Other medicines can also alter stool frequency or consistency. If your bowel habits change shortly after starting a medication, changing the dose, or adding another drug or supplement, tell your healthcare professional. Do not stop a prescribed medication on your own simply because you suspect it is affecting your digestion. There may be safer ways to manage the side effect depending on the medication and your individual circumstances. Medications that affect appetite and digestion also deserve careful consideration. GLP-1 receptor agonists are widely used for diabetes and in some cases, weight management. These medications mimic the action of a naturally occurring hormone pathway and can slow stomach emptying and affect appetite and gastrointestinal motility. Nausea, constipation, diarrhea, and other digestive side effects can occur. Rare but serious gastrointestinal complications have also been reported. So, persistent severe symptoms should not be ignored. If you take a medication in this class and experience significant or worsening abdominal symptoms, persistent vomiting, severe constipation, inability to pass stool or gas, or other concerning changes, contact your healthcare professional promptly. The right response is not to make assumptions about the medication, but to have the symptoms properly assessed. There is another reason constipation and slow digestion deserve attention. The digestive tract is a moving system. Food does not simply sit in one place until the body decides to remove it. Muscles throughout the gastrointestinal tract coordinate movement through a process called motility. Nerves, hormones, the gut microbiome, hydration, food composition, physical activity, and medications can all influence this process. When movement becomes too slow, stool can become harder. When movement becomes too fast, stool can become loose. The appearance in the toilet is therefore the final result of many processes that occurred hours earlier, and sometimes much longer. This is also why fiber and water are often discussed together. Fiber can add bulk and influence stool consistency, but increasing fiber dramatically without enough fluid can be uncomfortable for some people. A person who suddenly goes from a very low fiber diet to consuming enormous amounts of fiber may experience bloating and gas rather than immediate digestive perfection. Gradual changes are often easier to tolerate. Physical activity can also support regular bowel function. Even ordinary movement, such as walking, can be useful for overall health and may help some people maintain regularity. If constipation persists despite reasonable lifestyle changes, however, it is time to look beyond home remedies and determine whether an underlying issue is present. One particularly important clue is a change that happens together with weight loss. If your bowel habits change and you are also losing weight without trying, that combination deserves medical evaluation. The same is true for a persistent abdominal pain, repeated blood in the stool, ongoing diarrhea, severe constipation, anemia, fever, or unexplained fatigue. These symptoms do not prove cancer or another serious disease. There are many possible explanations, but they are reasons to stop guessing and seek appropriate medical care. The same principle applies to fatigue and weakness when stool changes suggest possible blood loss. A slow gastrointestinal bleed may not always turn the stool dramatically black or red. Small amounts of bleeding can sometimes be difficult to see. Over time, ongoing blood loss can contribute to iron deficiency anemia, which may cause fatigue, weakness, pale skin, reduced exercise tolerance, or shortness of breath. If you are experiencing those symptoms, a healthcare professional may consider blood testing, such as a complete blood count, along with additional testing based on your history and symptoms. You do not need to wait until you see obvious blood in the toilet to mention unexplained fatigue or suspected gastrointestinal bleeding. There is a simple rule that can make all 10 warning signs easier to remember. One unusual bowel movement is usually less informative than a persistent pattern. Your stool can change because of what you ate yesterday. A large serving of beets can alter the color. Iron can darken it. A sudden increase in fiber can create more gas. A temporary infection can cause diarrhea. A change in routine can affect frequency. Those things happen. Your digestive system is not perfectly identical every day. What matters more is a change that has no obvious explanation, keeps returning, becomes progressively worse, or appears alongside other symptoms. And there is something else worth remembering. The toilet is not a laboratory. You cannot diagnose gallbladder disease, pancreatic disease, celiac disease, inflammatory bowel disease, bleeding, or cancer simply by looking at stool. Appearance can provide useful information, but it cannot replace medical evaluation. If something worries you, the goal is not to diagnose yourself from a color chart. The goal is to recognize when a change is unusual enough to discuss with a professional. So, the next time you look before flushing, think about the bigger picture. Is the color dramatically different from normal? Is the stool black and tar-like rather than simply dark? Is there bright red blood that cannot be explained by food? Is it repeatedly greasy or oily? Does it float every time and smell unusually foul? Has the consistency shifted toward persistent hard pellets or ongoing watery diarrhea? Are you seeing substantial mucus? Are large amounts of undigested food appearing repeatedly? Has your bowel frequency suddenly changed? And perhaps most importantly, are any of these changes happening together with pain, fatigue, weakness, weight loss, fever, dizziness, or other symptoms? Those combinations are much more meaningful than any single visual detail. Your digestive system is one of the body's busiest systems. Every meal passes through it. Nutrients are extracted, water is regulated, microorganisms interact with the material that reaches the colon, and waste is eventually prepared for elimination. The final result can reflect many of those processes. That does not make stool a perfect diagnostic tool, but it does make it worth noticing. You do not need to become obsessed with every trip to the bathroom. You do not need to inspect every bowel movement with anxiety. Instead, learn your normal. Know roughly how often you go, what your typical stool looks like, and whether you generally pass it comfortably. Once you know your baseline, a genuine change becomes much easier to recognize. And when a change is persistent, unexplained, or accompanied by concerning symptoms, do not wait for it to become dramatic. Talk with a healthcare professional. Sometimes the explanation is simple and harmless. Sometimes it requires treatment. The only way to know the difference is to evaluate the whole picture. The most important lesson is not that every strange-looking bowel movement is a warning. It is almost the opposite. Your body changes from day to day, and many temporary changes are completely ordinary. The lesson is to recognize the difference between a passing variation and a persistent pattern. So before you flush, take a second. Notice what is normal for you. A change in color, consistency, content, or frequency does not automatically mean something is wrong, but a lasting, unexplained change deserves your attention. Your stool cannot tell you everything about your health, but sometimes it can tell you that something has changed. And that can be the moment when paying attention matters most.